I'm Michelle Liu. I'm a parent of a former PHer and also a physician. My daughter was diagnosed with PH in 2012 when we were living in Europe. She had a sudden cardiac event and it was right in front of me. She had been jumping on a trampoline and I thought she had hit her head because she was tumbling and she was 2.5 at the time. But the CT scan was negative and she was sent to a pediatric hospital in the Netherlands where we were visiting, and she was diagnosed with PH very quickly after her echo. We stayed in Holland for 6 weeks. She was in intensive care. She had another cardiac arrest, so her second, which was 45 minutes long, and we really didn't think she was going to make it through that one. But fortunately she did. That brought us back to the States where she continued to get care. The challenging thing for us was hearing that she was diagnosed with end-stage pulmonary hypertension, so not more than a year expected for her to live. Because I'm in the military, we move a lot. She has had 5 pediatric cardiologists. 2 of them were in Holland when she was diagnosed, and we've had several in the States, one of whom was a military pediatric cardiologist who just followed along just so that I could get everything in the records, honestly. And he was someone I could ask for consults very easily. She was placed on IV medication, and she was also put on 2 other oral medicines, specifically for PH. She was on a total of 6 medicines as a child with PH with end-stage disease. We did send her to school and camp and all those other things. Of course, not everyone was comfortable having a child with her condition, and so we had to look around. But there came a time, actually, my husband noticed one day that her face had some swelling. After that, she was put on a diuretic that would help to reduce that fluid overload. And that was when we realized we're going in the wrong direction. Despite increasing the IV medication to levels that our doctor at the time felt was about as high as he was willing to go, we were kind of at a wall. We just didn't feel there was anything else to do. And that was very hard to face. And I know that many parents feel like they're at that point. And that was when we started to have conversations with our doctor about transplant. What about transplant? Now, I know some doctors bring it up, and in some cases, the family brings it up because they hear about it on Facebook, they read about it online. But I have found that not all doctors are comfortable with that option. Maybe they've had a lack of success referring patients, or they're just not sure when to refer. I really relied on Facebook to guide me at that point, and I contacted someone on my own. I'm really happy I did, because I went and got her a transplant evaluation within a week. They were able to see me. It was in another state. At the time, having evaluated her, he felt that she wasn't ready for a full-blown transplant evaluation. This was another cardiologist, and we were happy about that. We're like, okay, great. But he was willing to go even higher on the IV. We actually saw 3 cardiologists at that time. We were the ones carrying the information between each doctor. They weren't talking to each other. We were doing all the translation of information. We realized she was being hospitalized more and more in the winter, and there were some crises. There were some difficult times where I, even as a physician dealing with her at home, did not know what to do. To go to the hospital, I would just ask her how she felt. You know, do we need to go to the hospital today? And I trusted her answer. And if she said yes, because no kid wants to go to the hospital, I knew she needed to go. We got to a point where we, in the middle of winter, went for a follow-up with the doctor who was considering the transplant evaluation, and he told us now is the time. She was that severe, and he didn't feel that she was going to get much better. And he actually has his own little formula. I know that a lot of the specialists joke that there's no formula, but this one had his own personal formula. We trusted his opinion. And she was evaluated a few months after that, and things moved pretty quickly because she was getting worse. So after that transplant evaluation, within 4 months, she received lungs. So when we got that call, it was not easy because we had just finished moving into a house the day before. We were unpacking, and at midnight, we got a transplant call. I saw that number and I recognized the area code, and we had to be there in 3 hours. And so we picked her up out of her bed and put her in the car, and she woke up in that hospital. And I will never forget that day, but she had her transplant. It took only 4 hours. They rotate surgeons, but it was done by a surgeon that I had heard of, and I was hoping it would be that one. The first week was rough. We were told up front the first week after transplant is like a roller coaster, and it certainly was. It was the scariest ride I've ever been on. You know, whether there was going to be a dip from hour to hour, it was rough. And you can imagine, she had received another child's lungs, and her body had to acclimate. And so there were fluid shifts, and she was on the vent, and there were some complications early in the first week that were not anticipated that made the course even rougher. Yeah, she even had a cardiac arrest that first week, and so she almost didn't make it. But there was a great team, and they recovered very well, but it was scary. After that first week, she moved in the right direction pretty quickly, though. So that was 2014. She'll be celebrating 4 years this summer. Post-PH, I would say for her, much better. I remember what it was like for her towards the end of her PH life. It was another life. She was sleeping in our room with a feeding tube. She was the size of a 2-year-old, and she was 4. Which I cannot even imagine, but it was true. I mean, I didn't see it, and I was her parent, but she weighed the same amount as most 2-year-olds do. She also was wearing oxygen at night and on a lot of medicine, and was starting to have trouble walking up 6 stairs from our living room to our bedroom. That was hard, but she still acted like a normal kid, and she still went to camp. Her discomfort eating, or her lack of desire to eat, was because I think she had symptoms when she was eating. You know, the heart was working like a machine. You could see her heartbeat through her chest before she was on medicine. So her heart was really in bad shape. The other thing is she wanted to swim really badly because her brothers swam, and she always had to sit on the side of the pool with her feet in, or actually walk in the baby pool. That was all she could do. And that was her wish that year, was that she could swim with her brothers. And so after transplant, that was one of the first things we did. And so, you know, her line came out, and she was at the beach within a month. It's pretty amazing. Post-transplant, she swims every week, and she will be on the summer swim team this year. She loves it. She is a brown belt in American freestyle karate. She is a soccer player. She likes to play goalie as well. And she loves to run. Another thing that's special is we have her in Montessori school, because we still live with the concern, you know, transplant is not a cure. It is a way to prolong life and to add to the quality of life. And I know that. It is scary to think what the timeline is and to hear some of the statistics about transplant. But I will say it's been worth every day that she's had a better day than she did with PH, because she was so sick. I love watching her do all those things that I've mentioned and more. I just want to help her to extend her days and her years. So Montessori is just a part of that. She's in a class with 12 kids, grades 1 through 3, only 12 kids. And she's a very special teacher, and all her classmates know what she's been through, at least superficially, and know that they need to take care not to bring their sicknesses to school. I couldn't see homeschooling her just because she loves being outside of the home. And so that's why we have her in that type of school. My name is Michelle Liu, and I'm aware that my daughter, Esther Grace, is rare.